Hello everyone, I am Dr. Manju Gupta, Senior Consultant Obstetrics and Gynaecology from Motherhood Hospital, Noida. Vaginal birth after caesarean section. So there are various facts and myths which are there about VBAC. What are the patients which fit into the category for VBAC? Who should try, who should not? What are the benefits, what are the pros and cons of having VBAC? So VBAC is basically vaginal birth after caesarean section. Vaginal birth after caesarean section can definitely be tried and can very well happen, but there are few prerequisites. Prerequisites, we say that if the interconception period between the two pregnancies is 18 months, means a patient has delivered now and she conceives next pregnancy after 18 months of the previous birth, then yes, she is a candidate who can try for vaginal birth. If the previous scar at 36-37 weeks or at the time of delivery is more than 3.5 to 4 mm, then yes, she is the candidate who can try VBAC. Other factor is that baby position, which we say for any vaginal birth, baby should be in cephalic position. Patient definitely should ideally go into labor on her own. Induction is not a very good phenomenon for VBAC, or bishop should be quite favorable if we want VBAC. So these are the factors which favor vaginal birth. Along with that, the baby weight should also be appropriate. Good size babies more than 3.2-3.5 kgs, they generally do not fit into the criteria of vaginal birth unless and until patient earlier also have had any vaginal birth with good size baby. History of vaginal birth before caesarean section or after caesarean section and now again trying for vaginal birth again is a very positive factor which tells us about the positivity of having VBAC this time also. So these are the factors which are positive or which are pro towards vaginal birth. But if suppose the baby weight is more than 3.5 kg, or if the previous scar is less than 3.5 or 4 mm, or patient does not go into labor on its own, or head is free floating, or if the position is not cephalic, baby is in upside down position, or the interpregnancy interval is less than 18 months. These are the factors which we say they are not in favor of vaginal birth. In those cases, we do demotivate the lady for VBAC. The other thing is that VBAC, the pros of VBAC is that yes, you are going for a vaginal birth. So the complications associated with caesarean sections are nullified in vaginal birth. The other advantage is that lady resumes the activity, the discharge from the hospital, the morbidity is much lesser in VBAC. But there are various risk factors also. The risk is that the scar giving up during vaginal birth is more. It is being said that it is 1% risk of scar rupture in vaginal birth after caesarean section. So we have to have constant fetal heart monitoring and scar tenderness to be evaluated with maternal pulse and fetal heart rate, so that if there is any sign of scar dehiscence, a lady can be taken immediately for caesarean section. So every time there is always a risk associated with scar dehiscence if we are trying for vaginal birth. The other thing is that sometimes the probability of vaginal birth is low. So ladies sometimes feel that she has taken all the pains and at last she's going for caesarean section. So that is one of the risk factors with vaginal birth. Otherwise, as such, apart from this scar dehiscence with an increased risk to the mother and baby, no other risk factors in trying for vaginal birth are there. Pain relief during vaginal birth after caesarean section, that is VBAC, can also be by IV injectables, which we go for in routine vaginal deliveries. Epidural is also a modality which can be used in VBAC. Epidural does not mask scar dehiscence because scar dehiscence is never evaluated by patient's pain. It is being evaluated by maternal pulse, mother's pulse rate and fetal heart rate. So epidural is a good option as a pain relief in vaginal birth after caesarean section. So this is basically all about vaginal birth. The factors which leads to vaginal birth more successful are lady going into labor on her own and a history of previous vaginal birth. They are the factors which favor more towards vaginal birth after caesarean section. Thank you.